Thank you, Brian, for the invitation to this very special symposium on integrative medicine. Today we'll talk about the integrative oncology part of our model for the breast cancer patients at the Kliniken Essen-Mitte. And that's our team. That's part of our team, maybe half of the team. We are more than 100 people. Originally, we started as a model institution of the County North Rhine-Westphalia to investigate scientifically complementary and alternative medicine, and in case it's positive, to integrate it in the mainstream medicine. Meanwhile, it's a regular department at the Kliniken Essen-Mitte, and we do have a long waiting list of 6 months, and many people are learning also from us. And we, for example, don't have any problems to get young doctors to work with us, which in our days is a huge problem in Germany. So that are parts of our institution. We do teaching, research, and clinical part. For example, in Essen, it's required for the medical students to pass an exam in complementary medicine. It's a required lecture in Germany, and especially in Essen. We supervise many students to do their doctoral thesis. To date, approximately 40. And we do postgraduate training in mind-body medicine and in complementary and alternative techniques. We do also research and publish approximately 20 to 30 Medline-listed papers every year. And in terms of the hospital, the clinical part, we do have a clinic, an inpatient clinic with 45 beds, an ambulance for integrative medicine and traditional Chinese medicine. We do have several cooperations with Chinese universities. We do have a department for integrative gastroenterology and a department for integrative oncology I will talk about today. So what is integrative oncology at all? First of all, it's very good mainstream medicine. That's the basis. And without good mainstream medicine, you cannot do a good integrative medicine. So the second part is the scientifically proven CAM, complementary and alternative medicine. And the third part is the mind-body medicine and lifestyle change. That's something very special also in our model, that the self-efficacy part is very important, that we train the patients from the beginning to become self-efficient in the way how they treat their own disease. So that's how we start with the mind-body medicine. That's in 1999. Several of our people were trained in Harvard at Herb Benson's place, who run a program, a symptom reduction program, which was very established at that time already. And we integrated as a part of the mindfulness work of John Kabat-Zinn, who at that time, also not far away in Worcester, was one of the recognized person, the mindfulness part. Meanwhile, mindfulness is a very common term, at least in Germany. Everybody is talking about mindfulness. When we started 17 years ago, nobody, at least in Germany, knew much about. So these are the different part of mind-body medicine. That's the explanation, the definition of the NIH. Mind-body medicine are interventions that use a variety of techniques designed to facilitate the mind's capacity to affect bodily functions and symptoms, and to differentiate between mind-body medicine and lifestyle change. You just add the nutrition and the exercise part, and that's the lifestyle modification part, and the other parts are the mind-body parts, which are basically designed as to relieve stress in different situations. So these are our mind-body trainer. I'm just showing this picture to show what it means, how many people we have working in this field and how important it is. And it's all covered by the hospital or by the insurance companies. Okay, so now what is very important are the treatment goals, to know what are the treatment goals of integrative oncology. And the most important part is that the use of integrative oncology is to improve management of side effects of chemotherapy and mainstream treatment. And this we have to say very clear, because that's the differentiation between quack therapies and integrative oncology, that we try to optimize the mainstream therapy and to optimize the condition of the patient. For breast cancer patients, it's mainly pain, nausea, vomiting, polyneuropathy, hot flashes, or aromatase-induced joint pain, and fatigue. Another goal is, of course, to improve physical and psychological fitness, to improve quality of life, reduction of depression, stress perception and anxiety, and to improve the compliance. That's an interesting finding. We find out that patients who have the impression that they are considered, that they are treated in a holistic way, they are more willing to accept and to adhere to the mainstream treatment. And very seldom we have patients who stop the mainstream treatment because of some quack therapies. And another advantage of integrative oncology, of integrating the scientifically proven CAM part into the treatment, is that you reduce the use of quack methods, because the patients know that they when they want, can ask the doctors what he thinks about, and they will get an honest answer. And the last part is improvement of prognosis. You see there are question marks. It will show in the future whether it makes a difference. I think it might have a difference, at least in terms of the stress reduction and the relief of the side effects. So our teacher were in the Sloan Kettering Hospital. I'm very proud that I'm talking today with Gary. Hi, Gary. And several of our people were trained there, also Petra, who is also here. And we adjusted the Sloan Kettering program to the German situation, which is different. And later I will talk about the differences in Germany and at Sloan Kettering. So, integrative oncology in patients. How did we integrate the complementary part into our wards? First of all, I must say that in our hospital, the Kliniken Essen-Mitte is one of the two largest centers for gyneco-oncology. The other one is at the Charité, and so it's a very prestigious hospital for gyneco-oncology, and our gyneco-oncologist is Professor Dubois, and the cynologist is Dr. Kümmel. So our doctors, our CAM doctors, do rounds twice a week together with a psycho-oncologist who is a part of the mind-body team in our hospital, and the breast care nurse. They offer several therapies like acupuncture, phytotherapy, different mind-body medicine techniques, nursing care, and foot massage, which we also learn from the Sloan Kettering people, which is very effective, especially for patients with ovarian cancer who have large operations, who are very weak. It's a very effective therapy. So all these cares are covered by the private insurance companies and not charged for legally insured patients don't have to charge. In this case, the hospital is charging for them. So now when the patients are admitted and are outpatients, then they get a questionnaire after the case was discussed in the tumor board, and they can decide whether they want to have a CAM treatment or not. Between 60% and 80% of all patients decide for a CAM treatment. Basically, every patient has the chance to get a treatment. Not everybody wants to have it, but theoretically everybody could have a treatment. So, and if they decide to have a CAM treatment, they have the history taken by a mind-body instructor and by a CAM practitioner, by a CAM doctor, and then we decide which therapies might be helpful for the patients, and whether it's psycho-oncology, art therapy, individual counseling, some presentations or group therapy, or for the CAM therapies like acupuncture, neural therapy, phytotherapy, individual counseling, cupping, hands out for self-care therapies. And the patients do have the chance to participate in an integrative oncology daycare clinic program, which is the mind-body program. We adjusted from the Harvard program, expanded it from 2 hours to 6 hours, and which is very helpful for the patient. In the last 16 years, approximately 5,000 patients went through this program, and 2,000 cancer patients. All these offers are covered by insurance companies, by the private insurance companies, and for the legally insured patients, the hospital is paying for them. So the patient in general do not have to pay for the treatment. So what are the different treatments of the different people in the mind, body, and the CAM team? So the CAM MD, CAM specialists, they are, for example, offering counseling, different kinds of acupuncture, body acupuncture, ear acupuncture, electroacupuncture, neural therapy, gua sha massage, cupping, phytotherapy. And in phytotherapy, we also refer to the website of the Sloan Kettering Hospital about herbs, which is very helpful for us and also for the patients. So the mind-body offers therapies are the mind-body counseling, nutritional counseling, exercise, yoga therapy. Yoga also plays a very important role in our model. We also are a yoga research institute and publish approximately 30 papers on different yoga therapies, also in cancer patients. Since recently, we also have an art therapist, relaxation groups, and exercise groups. So nursing, also the nurses play an important role in the CAM treatment, and we train the regular nurses at the wards in different CAM treatments like ginger, lumble, wrap. It's only kidney because it's in the kidney region. Of course, it doesn't have much to do with the kidney. Beeswax compresses, lavendel heart compresses, which is very effective. That's just lavendel on the heart and a wet wrap above. And for example, the nurses voluntarily start to give every patient on the ward such a wrap when they start their night shift, because it's so relaxing for the patients that they sleep and don't wake up in the night. And it takes approximately 5 minutes per patient to prepare the wrap, and in 20 patients it's nearly an hour, or it's more than an hour, but it's worthwhile for the nurses because then they have a calm night too. So beside that, we have physiotherapists, breast care nurse, nutritional counseling, social service, pallium, and so on, which is integrated in the regular clinical process. So in terms of acupuncture, we try to focus on the diagnoses that are at least not evidence-based, complete, but at least they should have a 1B evidence, and these are the indications with the studies which mainly are published in high-quality journals like Journal of Clinical Oncology. For example, polyneuropathy, dry mouth, hot flashes, fatigue, chemotherapy-induced joint pain, depression, which is approximately the same indications as scary dengue before reported. So we also use ear acupuncture, which is from the organizational term easier because the patient don't need to undress and we don't need to lie down. So these are the numbers for the breast cancer patients altogether. In 2014, we did more than 7,000 different chemotherapies. And now let me talk about our Mind-Body Medicine Daycare Clinic program for cancer patients, because that's something very special, which I think does not exist at another place except in Zurich nowadays. So that's the physician, and that's the mind-body instructor, and all the other ladies are patients. And they meet once a week for 6 hours. And that's part of the program. Nutrition plays a very important role. We do have a teaching kitchen, and we do teaching kitchen lectures with the patients on healthy nutrition, on whole grain healthy nutrition, vegetarian, and they have an exercise program which is part of every single lecture, and the relaxation therapy. And the relaxation therapy in our case is the different parts of the MBSA program, either body scan or meditation or yoga, and that's also in every single lecture. And it's important that the patients learn these things to integrate it in their daily life. And that's the advantage of this program, that they see the mind-body instructor and the doctor every week. And they have to fill out a diary, and they talk about what was the problem to keep the program. And if they had specific problems, they can talk about and can find solutions. Mostly the partners are the problem, because they get some kind of confused when their partners now want to eat different things. They withdraw themselves and start to meditate, and they just do other things. And so we also have to talk to the patients how they can solve these problems. So they learn several self-care strategies, and we do medical rounds in a group setting, which is something new, but it's very helpful because the patient see that the other patients do have similar problems, and it helps to bring the group closer together. And the group setting is a healing component by itself. And for example, the patients say that this daycare clinic is the day they are looking forward, because they see all the friends, they can talk about their problems, and it's a very specific situation. For example, we do have a specific group for patients with metastasis. And it might happen you talk to a patient who just came out of the group, and you ask him, and you know he's full with metastasis, and you ask him, how are you today? And he smiles at you and says, I'm great. And that you can reach with the mind-body treatment in this group setting. So, and these are the different educational programs, like concept of psychoneuroimmunology, relaxation techniques, management of stress, cognitive restructuring, yoga, nutrition, social skill, coping skill. So that's briefly the program. Altogether, these are 11 visits per patients for 6 hours, once a week, and they are in one group with 8 to 12 patients. Lunch is included. It's a Mediterranean whole food lunch. It's covered by all insurance companies, and we do have 4 different formats. And I think that's also something new. No other institute or no other clinic has this. We do have the regular daycare clinics after the mainstream treatment. We do have a daycare clinic during chemotherapy. So 1 to 2 days before chemotherapy, patients meet in the daycare clinic, and beside the regular program, they get a specific acupuncture treatment, and it's very helpful to relieve the symptoms of the chemotherapy. And meanwhile, we do have many patients who especially come for the chemotherapy, even though they did not have the operation in our center, because they knew that they get this program. We do have a specific program for anti-hormonal therapy. These patients do have specific problems because of the medication, and as I talked before, the program for the patients with metastases. So the difference is mainly that for example, the people during chemotherapy, they get specific acupuncture for the symptoms they might get during chemotherapy, and this setting is an open group. That means they can come when they have their chemotherapy, or 1 or 2 days before. And the regular group is a fixed group where they meet every day, every week at the same day in the same group. So for the anti-hormonal therapy, they also get acupuncture treatments in addition. And the group with the metastasis patients, that's also an open group, and they come when they feel like, and in general, they come as often as they can, depending on their condition. So what is new in our model? CAM is fully integrated in one of the 2 largest gyn-oncological centers in Germany and Europe, and is well accepted. I think that's very special, because it was very difficult also to integrate it so that it was accepted by all the major players in the center. CAM physicians and mind-body instructors are part of the cancer team. That's also important, that they work together, they go together to the rounds, and they discuss the patient case together. Permanent CAM research and guideline work. So we do a lot of guideline work and meta-analysis. For example, for the breast committee guideline work of the Society of Gynecology in Germany. 60 to 80% of all the patients get CAM treatments, care for in and out patients. Treatment is free of charge for most patients. Nurses are trained in CAM therapies and daily mind-body medicine daycare clinics, clinic programs in 4 different formats. So every day we have a daycare clinic program. So what is the stuff for the integrative oncology? We do have 2 senior doctors, 4 physicians, 3 naturopaths, 2 psycho-oncologists, 4 therapists, 4 mind-body therapists, and 2 medical assistants. And that's the whole team. So thank you very much.